Awesome. Let's get the show on the road. Welcome, everyone, and good afternoon. For those that I haven't had the pleasure of meeting yet, my name is Wilson Toe. I head up the worldwide business development practice for healthcare at AWS. And for those that I see year over year, this is a happy family reunion, so it's always wonderful to see you all. Today, we're going to be talking a little bit about data-driven care for individuals and populations. I'll be sharing a little bit about some of the work that we've been doing across 2019 with our customers and partners. And I'll also be joined on stage by Ryan Hamilton, the Senior Vice President for Population Health at Cerner. So one of the things that you probably have heard kind of time and time again throughout this entire week, as well as probably every single engagement that you've had with AWS, is just how customer obsessed that our organization is. And it really drives and defines a lot of what we do here at AWS. And when we say customer, for the healthcare practice here at AWS, it spans across the entire spectrum of care. When we look at the work that we do with healthcare providers, for example, whether it's health systems, whether it is around academic medical centers, clinics, all the way through to insurers and payers, whether they're health plans or employers, to government organizations, ministries of health, research organizations across the board, regulators, and even across the healthcare vendor space, whether they're healthcare IT companies or medical device manufacturers, for example. I think what you'll find across every single organization on this board is that they share a common mission. And that's something that's shared here across our healthcare practice at AWS. And they're centered around the healthcare consumer. And when you think about all the work and all the missions that align to help enable what it truly means to be customer obsessed when it's focused on the healthcare consumer, that's when things can be transformational. And so some of the work and the discussions that we'll be sharing in examples today really highlight and discuss and dive deeper into some of the work in that area. Because at the end of the day, when you think about what it means to truly bring everyone together and truly help elevate the human condition, it becomes really transformational. And so we'll be sharing a little bit about that today. And to really kick things off, I want to go back to a slide that I shared last year because it continues to remain true for a lot of what we do. And that is security and privacy truly does remain job zero for us here at AWS. So when you think about the 50 plus accreditations and certifications globally that we have to support things like health data hosting in France, all the way through to HIPAA here in the US, it becomes transformational when you're able to think less about the undifferentiated heavy lifting that you have to support from a certification or accreditation perspective and really think about how are the big problems that you want to solve in healthcare. When you combine that with all the security enhancements and tools and capabilities that customers have when they're looking at taking advantage of the 1 million plus active customers that use AWS every single month, or the industry-leading security teams that help drive a lot of the 24/7, 365 days a year efforts to help protect what is happening in the cloud, it helps define a lot of what we can do. And what customers are left with is a security infrastructure that is built to satisfy healthcare. And when you think about the complexities and the regulatory environment that we all work in and operate in today, it is very hefty. And those are the ways that we continue to enhance and support customers as they're developing on AWS. And when we dive a little deeper into that and look at what it means from a healthcare perspective and look at security and compliance for healthcare, that's when we start looking at the investments that we continue to make across 2019. As you can see, and something that we discussed last year as well, HIPAA continues to remain a big case for what a lot of the activities that organizations are doing here in the US. And so since then, we've launched over 100 HIPAA-eligible services that customers can take advantage of. So whether they're storing, processing, or transmitting any sort of protected health data, they're able to do so using those HIPAA-eligible services. Earlier this year, we also worked with the HITRUST organization to think through what does it mean for the common security framework to take shape and form across AWS services in the platform there. And we've launched since then over 60 HITRUST certified services to help drive what it means to take advantage of that common security framework. So whether it's national or international standards and regulations such as GDPR or ISO or NIST or PCI or even HIPAA, when you're able to bring those together to create a comprehensive set of various baseline security and privacy controls, you're able to move up and think about the core IP and solutions that you're able to drive across the board. And when you think more broadly around what's happening around the world, Things like GDPR just take form and shape, especially in healthcare. And so it's, a lot of it has been driven in Europe, but there are global implications from a patient privacy perspective. And so a lot of the work that the organizations have done in order to help understand what are the best practices, what are the different guidelines, how do we help support customers as they're exploring what does GDPR mean for them, they're able to take advantage of those resources as they're building out their practice across the board. And as a result of that, we're seeing major types of innovations that are happening in the industry today. And as I mentioned before, whether they're healthcare payers, healthcare providers, healthcare IT companies, we're seeing more and more innovation take place across AWS, all centered around that healthcare consumer. And it's fascinating. And so when you think about the ecosystem that is created around that, you're able to see how everyone in this room is able to work together towards that common mission. And as a result of that, when you're shifting out that undifferentiated heavy lifting and you're able to focus on core capabilities around how you're able to innovate, it truly becomes transformative in the world. Some of the capabilities that I hear time and time again from our customers and partners is AWS Marketplace. Last year we touched on this a little bit. At the conference HIMSS earlier this year, we announced the Healthcare Life Sciences catalog for healthcare life sciences on AWS Marketplace. And since then, AWS Marketplace has grown not only in selection, but also capability, allowing customers to discover, procure, and deploy solutions and deploy them right into their AWS environments. And you can see from over 1,400 participating ISVs that are listing over 4,800 solutions, it becomes very powerful in how you're able to streamline software procurement and deployment in your AWS environment today. And since then, 230,000 active customers have been driving and using AWS Marketplace in order to help streamline their software deployment cycles. Since then, as you can probably imagine, and as I mentioned earlier, healthcare life sciences has become a growing catalog and category within AWS Marketplace. We've launched and have participating ISVs list over 95 different software listings, from Change Healthcare to Amber Health to InterSystems and Illumina. So across the board, you're able to see a number of partners and as well as key ISVs participating in how they can streamline and list their products on there in order for customers to continue using them. Alongside of that, we also launched the machine learning model marketplace to help drive what does it mean to not only look at software as it's being deployed in those types of customers, but also what does it mean to deploy models? What if I don't have a data science team and I want to be able to take advantage of different data science practices and incorporate them into my practice? Since launching, we've had customers and partners and ISVs list over 45 different models that range from predicting the onset of hypertension to various conditions, because they understand and realize that as they're deploying data science as a practice into clinical care, for example, they're able to drive early screening towards early detection, towards early intervention, to really streamline the entire flow of how clinical care can be impacted using data science from that capacity. Earlier this month, we also launched AWS Data Exchange. And so for those who haven't had the pleasure of reviewing this or taking a look at some of the work that the team has been putting together for customers and partners, AWS Data Exchange makes it easy for customers to find, subscribe, as well as take advantage of and use third-party data in the cloud. Qualified data partners like Change Healthcare, for example, process over 14 billion healthcare transactions every single year. And that equates to about $1 trillion in claims annually as well. So the power of the data that can be unlocked across the board there is instrumental for how organizations can really think through what does it mean if you have access to non-traditional data sets that you haven't historically had access to? And what does it mean for your data science practice as you're building that up? So AWS Data Exchange allows customers to not only quickly find diverse data in one place, but also move that data and analyze that data through the entire portfolio of AWS capabilities, whether it's around looking at data warehousing with Amazon Redshift or building data lakes across the data that they have access to in these new data sets through AWS Data Exchange, and utilize AWS Lake Formation to really understand how do you put that all together and make a better understanding from that. When you are able to kind of move beyond the traditional data sets that you've had access to and be able to take advantage of those data exchanges, Wanted to share an example with you about one of the customers that have recently listed on AWS Data Exchange, organizations like Dana-Farber Cancer Institute, who are spearheading new initiatives that are leveraging AWS Data Exchange. And I wanted to share a quote with you. It's a long quote, but I wanted to really highlight kind of two things. And this is from Dr. Lori Glimsher, President and CEO of Dana-Farber. And it really speaks volumes around how AWS Data Exchange is accelerating a lot of the collaborations that take place and really putting together those data-driven approaches in development of various therapies and how that impacts patient care at the end of the day. But that last part of the quote, and I want to highlight this, it allows organizations, and Dana-Farber in particular, to explore new ways to transform the lives of cancer patients in a socially responsible and regulatory compliant manner. And that's important for a lot of what we're doing across AWS. And it continues to become a very strong driver for the broader industry adoption of AWS Data Exchange as they're looking for these types of data sets. As the first NCI designated comprehensive cancer center, Dana-Farber is blazing in the trail for cancer centers as well as academic medical centers as publishers of on AWS Data Exchange. And they seek to leverage the data exchange to increase and accelerate sponsored research with pharma companies, for example, initially around a prostate cancer data set. And subscribers can only get access to that data once they've negotiated a sponsored research agreement with Dana-Farber. So it allows not only that ownership control to take place, but also as you're looking beyond what's happening in the healthcare industry and look across a number of different settings and segments, you're able to see what is that convergence point that's happening across healthcare and life sciences as it relates to better patient care and better outcomes across the board. Taking a step back and looking at reInvent last year, we announced Amazon Comprehend Medical. As you guys probably remember, it's a HIPAA-eligible service that allows machine learning to extract medical information from unstructured text. So whether it's healthcare entities related to tests, treatments, procedures, whether it's related to medications, but also the relationships across those specific entities. So not only is it important for me to know that I'm taking ibuprofen, but what's the route? What's the dosage? And really put together what it means to streamline an entire process of NLP specific for healthcare. This year, for those who have been following along some of the announcements from earlier this week, we announced Amazon Transcribe Medical, a HIPAA-eligible service specifically around automated speech recognition for healthcare. And that's powerful because it allows and enables developers to add medical speech to text capabilities across any sort of voice-enabled applications. And when you think about removing that undifferentiated heavy lifting and focus on the impact that this is able to drive, whether it's streamlining clinical documentation, whether it's supporting pharmacovigilance activities across the board, or even telemedicine as a whole, it removes or it helps support that efficiency that you're able to drive within how you're able to implement these services and puts the focus back on the patient. More and more capabilities, when we're looking at it from a data perspective, are supported by services like this, when you're using Transcribe Medical or Comprehend Medical to help streamline what does it mean from your data practice across a healthcare organization. So there's been a lot that's been happening across the board. And the team has been excited to work very closely with customers and partners throughout this year to help solve not only some of the toughest challenges in this space, but really start understanding what does that healthcare journey look like. And one of the things that I wanted to share with you was a piece of what we've been able to observe that our customers have been talking about. And it really starts with understanding how does it accelerate and what does it mean to accelerate healthcare transformation across the board? So whether it's related to clinical practice or looking at operational processes, what does it mean to start a cloud migration for healthcare organizations? And how are they able to support that from a tooling and capability perspective? And once they move data to the cloud, they want to be able to understand what does it mean to operate in the cloud to support healthcare data interoperability and have a much more comprehensive view of what's going on across the patient base. And from that, they're able to then use that to use any sort of analytical tools, machine learning model development, and really think through what does it mean to support operational and clinical excellence through their practice. And lastly, once they have a better understanding of what can and potentially might happen to an individual or population, how do we personalize that healthcare journey for those populations and individuals? And that's powerful because it becomes a basis for how healthcare organizations can drive specificity and accuracy for a lot of the types of initiatives that they're driving in the market. And I wanted to go dive a little deeper into that because we're seeing this more and more become the case where healthcare organizations want to be able to not only look at cloud migration, accelerate cloud migration across the board, but they're responding to a number of things that are happening in the industry, some of which, as you probably have seen throughout a number of headlines in the past, or what the industry has been talking about, day after day, month over month, around security. And it becomes, as I mentioned, job zero for us here because we see how we can better support and enable healthcare practices as we're looking at the security breaches or malware incidences that they might be addressing across their board. Second, we're continuing to see a lot of mergers and acquisitions across the board. And customers are taking advantage of this opportunity to be able to streamline as well as rationalize a lot of their IT footprints. That way they can drive down any sort of costs and drive up any sort of efficiencies that they have in the system. Thirdly, as we're seeing more and more operational systems become more commonplace and common practice for healthcare organizations, we're starting to see a number of clinical systems migrating to the cloud. These are mission-critical clinical systems that historically have been looking at new ways in which they can operate successfully in the cloud, and they're starting to take shape and form in that case. And then lastly, speaking and mapping back to what I discussed around AWS data exchange, being able to manage new data types and data sets that they historically haven't had access to. And we're seeing it more and more become the case where they're able to take advantage of any sort of data sets that they haven't had access to and put it all together to have a better understanding of how they can impact care from that capacity. When we're looking at organizations and how they're supporting that migration, some of them will go all in. Some of them will go and leverage hybrid development footprints for how they can continue to work directly with AWS. Earlier this year, the NHS Digital announced that they were going to be working with VMware Cloud on AWS. And so for those that haven't been exposed to NHS Digital maintains and develops mission-critical IT infrastructure that underpins the NHS and the social care system. And so they enable 1.4 million NHS staff and 1.5 million social care workers across the board to enable the best type of practice and care for their organizations and customers today. And so when you're thinking about how cloud migrations can help support this, they're able to look across the entire application base and understand that although they don't have to re-architect anything, they can still take advantage of existing policies, look at IP addresses that can be maintained, and really start developing what does it mean to operate in the cloud and take advantage of a very familiar common console that they can then leverage using VMware. And we're seeing more and more organizations take advantage of, what does it mean to do even more in the cloud? Huashan Hospital, for example, is a 1,216-bed hospital affiliated with Fudan University, serving 1.1 million patients annually. And the hospital enjoys a strong reputation not only in the clinical space, but also in the research space as well. And they're a designated hospital for the National Health and Family Planning Commission, is a Fudan University affiliated teaching hospital, and is the basis for a lot of what's happening at the Chinese Red Cross. Earlier this year, Huashan Hospital deployed their reservation bus system to help streamline the patient scheduling systems to then look at how can they more intelligently figure out how to optimize the number of individuals that will be going to the hospital, but also reduce wait times as they're going into the hospital. They're also using and taking advantage of AWS resources for quantitative pharmacological analysis on the research side, and then moving that into clinical practice as well. So not only are they able to cost effectively and efficiently drive a large number of computational processes that were generally too difficult to handle on premise, they're able to now develop that and run a number of those different analyses in the cloud today on AWS. And they successfully developed a vancomycin drug decision support system that drives personalized decision-making for those individuals that go into the hospital. And so their smart dose application, for example, has successfully been deployed across more than 80 different medical settings today. And so we're seeing more and more research not only take place in the cloud, but as that translational aspect of it moves into the clinical setting, we're able to see how it can truly impact patient lives from that capacity. So it's wonderful to see more organizations move to the cloud, understand what they can be doing with healthcare data, and more importantly, as they're looking across all the data sets that they've had access to, driving data interoperability is crucial and core to a lot of initiatives that are happening across 2019. And this is not only across healthcare providers around the world, but also healthcare payers as well. And underlying that and supporting the entire system from that capacity are a number of healthcare IT customers and companies that are dedicated to driving this and supporting this across the entire industry. And so Change Healthcare, for example, earlier this year at HIMSS announced that they were enabling free healthcare data interoperability services for all Americans on AWS. And so when you think about the types of capabilities that they were providing to help support what interoperability means, whether from a semantic or a syntactic perspective, they're able to now provide record locator services, for example, or identity management services for those organizations. And more importantly, document retrieval solutions with the protection and security of privacy around patients and what it means for them. And so when you remove the cost prohibitive barriers that have hampered open interoperability across the healthcare system, it helps accelerate healthcare data exchange and helps support what providers ultimately want to do, not have to track down patient records across different health systems as an individual is going through their entire health journey, but they can focus on patient care at the end of the day. Later on this year, there was a press release around some of the work that Change Healthcare is now doing with Commonwealth. And so there's a session later that will be diving a little bit deeper into this, but Change Healthcare announced some of the work and their initiatives around the Commonwealth Health Alliance. Whereby both organizations will be supporting joint clinical data interoperability across a number of the key alliance members that are participating in that network and alliance. And Commonwealth already connects over 13,000 provider sites with records for more than 50 million unique individuals. And so when you remove that barrier of interoperability challenges that exist, and you're then able to focus more on the IP development or solution development for a number of customers, you're able to accelerate a lot of what's going on from a healthcare data practice perspective. And so organizationally, what you'll find is more and more it will be the case of data becoming much more of a strategic asset and organizations being able to take advantage of what does it mean to focus less on that undifferentiated heavy lifting, as I mentioned before, and focus more on solutions and the patients at the end of the day. So I wanted to take this time to introduce to you a key partner of ours across AWS, and it's my distinct pleasure to welcome Ryan Hamilton, who I mentioned is the Senior Vice President of Population Health at Cerner. So please join me in welcoming Ryan.
Thank you.
Of course.
Good afternoon. I'm a population health guy. I should make you stand up and move around a little bit too, but I want to take a few minutes to, first of all, just thank you for the time today at AWS and you to give us a platform to explain kind of Cerner's vision for the future. For those, and how we think by working together, we can actually transform healthcare. For those who aren't familiar, Cerner is one of the largest pure play healthcare IT companies in the world. We have about 25,000 associates who help more than 3 million providers deliver care at about 27,000 facilities in 30 countries. So we have a lot of data. What's super interesting though is while our legacy is an EMR company, what became obvious to us is if you're going to transform healthcare, even if every healthcare facility on the planet used a Cerner EMR, we'd still only have 20% of the data we need to effectively manage people to their outcomes. And so while our history is sort of as an EMR company, our passion and mission is really how do we transform healthcare? And as we started to think through what that looks like and what would our partner strategy around this be, it really came down to a few different key attributes. The first is we have to think larger than healthcare, and how do we think about people in their daily lives, and how do we think about it across industries? So how do we think about collaborative environments where innovators come together safely and securely to innovate together on the future? How do we engage consumers, not just patients? How do we bring that data together in such a way to understand their unique needs, engage the consumers, and empower them to have control of their healthcare, much like you see in every other industry? Then how do we think about connected and coordinated care? How do you coordinate, if you think about things like diabetes, the detection of that and the diagnosis is very short, the treatment is lifetime. How do you actually coordinate care for people individually when 99% of their time they don't spend at a healthcare facility and they spend living their lives? So how do we connect and coordinate care across that entire continuum, across providers, the consumers themselves, and other industries and community-based resources? And the last is, and I think a big part of this conference, which you see with AI and ML, how do we sort of store and study each of the decisions so the next decision gets smarter? And so as we looked at the cloud and our transformation to it, it really kind of came down to 3 key phases. And I suspect most of your organizations are thinking about it in very similar ways. The first is, how do we migrate to the cloud? How do we do that way and safely and securely and be able to run at the service levels we intended? Then how do we modernize? So what are some quick wins we can get to improve that experience? And then ultimately, what's the disruptive innovation we can do in healthcare? And so sort of the 3 goals that they're very focused on right now in those pieces around migration. The first is healthcare IT innovation adoption is disappointingly slow. If you look at intelligence, it's got like a 17-year half-life. If you look at software, it's probably a 3 to 5-year half-life. So could we, by using the cloud and things like containerization and virtualization, could we create a SaaS-like experience around healthcare IT? So could we get innovation in the hands of providers faster with less burden on the organizations? The second is, could we then pick up in modernization a set of tools and things like AI and speech and those kinds of tools, and could we dramatically improve the experience? So if you saw the keynote this morning, our CEO was up there. One of the challenges we're working on is, could you sort of passively do the documentation for the provider, which they would review at the end, by observing what's occurring in those exam rooms with permission? And so can we dramatically not only change the experience for consumers while lowering the cost, improving outcomes, can we make sort of healthcare fun for providers? And the last is, can we do that in a way that sort of disrupts healthcare? So a big focus for us is, how do you make healthcare sustainable? And so a lot of what I'm going to talk about now is kind of, what does our disruption phase look like? And how do we see that being a collaboration across industries, not just healthcare and life sciences, but what role does transportation and banking and social services and public health, for example, play in that as well? So I think all of you are familiar if you're here. I mean, healthcare costs are rising dramatically. It's rapidly approaching, if it's not 20% of GDP. There's very little, there's no indication that's slowing down. And so those rising healthcare costs, while we come at it primarily historically from a health system perspective, doesn't just affect health systems. It actually affects all aspects of society around that consumer. And so the question becomes, how do you bring that together? So we've been intentionally partnering not only with health systems, but how do employers, how do health plans, how does state governments, both domestically and around the world, what are their challenges? What are their unique techniques? But our ultimate goal is, can we bring all of that together into a unified whole? So can all of those be participated and organized around the unique needs of individuals is the real mission and charter that we're on, and we would love your help. So how we see that working, we believe that technology is the key to that disruption. So if we're going to transform healthcare, we believe technology is that key. The question is, can we do that in a way that's sustainable? Can we create sustainable business models based on better outcomes at a lower cost? And to do that, we believe there's a new layer required in healthcare that we've called healthy intent. It's really organized not around the health system or the individual stakeholder, but organized around the individual. We can create lifetime data and relationships. And its real challenge is, can we identify and match the unique needs of individuals to resources in their community? And I don't just mean health systems. What role does food play? What role does public services? The most important resource I can give to some people is transportation, to make sure they follow up with their appointments. So how do we bring all that together? We see it really occurring in 3 phases. And you'll see pieces of this. While much of this conference and things I've heard are pretty focused on the first phase, I'll talk about the other 2. The first is, can you actually understand what's occurring with those individuals? Most of us spend a very fractional % of our time in a healthcare institution in front of a provider. We live in our daily lives. How do you bring all that data together, whether it's clinical, financial, social, behavioral, environmental, to actually understand what's occurring with people and probably clues to why? Can you use applied intelligence to define the right action? So do we know what to do? Do we know what's likely to happen? And do we know what likely interventions would actually improve or change that outcome? And then can we do that in a way that actually drives to the outcome? Not necessarily maybe clinically based, but what is based on the individual goals for that person? Do they want to live longer? Do they want to live healthier? Do they just want to see their grandkids graduate from high school? And so what's interesting is we studied the problem, and I talked about it earlier. Only about 20% of the data you need to do that, in our opinion, comes from EMRs and healthcare. So, and you can read the various studies. Some would say as low as 50%, some will say as high as 70 to 80% of our clinical outcomes will be based on social determinants. So what is happening to us socially? What is happening to behavioral? What are environmental factors? So we have to think about how do we bring all that together? How do we treat the whole person, not just them as a patient? And how do we do so in a way that actually engages them in that care? And I use Jane as an example. Jane's not just a patient. Jane's also a mother. She's a wife and the head of her household. She's a working professional. And she's trying to manage all that, including her family's healthcare data, on the go. And so we believe it really can occur in 4 steps. And this is how we've thought about it and organized it. The first is how do you aggregate and bring that data together? So how do we acquire it? How do we aggregate it? How do we normalize healthcare data into something that's both human and machine understandable? Can we then create and apply the best available intelligence? One of the greatest excitements we've had in our AWS partnership is the sort of the maturing of the AI and ML tools, which we think holds potential for mass personalization in healthcare at a cost-effective piece. No one's going to build the rule sets around personalizations manually for 360 million people in the United States. But we do see that potential with ML and AI to get really good at understanding my unique needs and being able to do that cost effective. The third is, can we then define the set of steps aligned to that individual's goals and barriers in such a way that we can cause action and measures? Can we coordinate care in such a way to change that outcome aligned with their goals? And how do we then integrate that into the workflow of the various resources we need? So most of healthcare will talk about how do you integrate into the provider workflow. We think an equal part of that then is how do you integrate to the consumer? Any one of us in 30 seconds or less could check our bank account, communicate with our friends and family, probably book an airline ticket, and could certainly book an Uber. Could any of us book an appointment with our provider in 30 seconds or less? Probably not. And there's really no technical barriers for that, and can we bring those down? And the whole concept for us is really, can we then create a personalized plan of care around the individual? Much like the record that's owned and lives with them, not their health institution. So what are my unique goals? What are the unique roles that I play? What are my unique barriers? And what's the set of interactions my larger care team, whether that's family or providers, are actually working on together? So when we thought about why cloud, it really kind of came down to those 3 phases. So I'll give you kind of a quick preview of where we are. So we looked at it in 3 phases. We're squarely in all of these phases with more major results on the left side. So from a migration perspective, they told us to start small. We started with, could we fully replicate our entire population health platform as an on-demand DR Saturday inside of AWS? So could we replicate data and spawn up an entire redundant system on demand as disaster recovery, which gave us all the uptime abilities that we want at a price point that was better for our clients. We also then quickly launched our Australian and our Canadian clouds. So what typically would have been 18-month deployment for us went down to weeks to be able to spawn and replicate that domestically. And we're actively migrating our US production clients to it today. We started the year with about 20% of our clients running in AWS versus on-prem. We're bulk moving 68 this week, and we will finish all of our US clients non-federal in the next 45 days. So in what was effectively in 9 months or 90 days or less, we will have migrated almost all of our production workflows for our population health platform to AWS. In terms of modernize, we're finding a lot of benefits in the services you saw this morning, what Wilson was talking about, what Andy and his friends were talking about this morning. A couple of key ones for us today is how do we bring in data from disparate systems and do it? We're working on some things now. We think over the next 6 weeks, we can cut that time by 80%. So from the time we receive raw data from a source system, whether that be clinical, financial, or public resources, we can go from something about 8 weeks to 2 while increasing our data quality and our data resilience. One of the most exciting ones we did earlier in this year in a partnership with SageMaker, we were able to cut our AI and ML times by 80% as well. So what was taking us 6 months to create a new AI model, we're down to about 4 weeks or less to fully bring that to live, test it, and deploy it. And then we're super excited as we get through the migration and the modernization pieces to how do we think about innovation. There's a number of those there. We have probably approaching 100 different AI ML models, ranging from how do we do prediction to provider workflow improvement to consumer engagement type pieces. We're innovating in combination with something we call Healthy Data Lab, which effectively is AWS SageMaker. And then what Brent talked about this morning or alluded to is how can we fundamentally change the provider experience as a key to this? You can pick your favorite study about burnout or usage of an EMR. Our president would have said we're the only people who put the rock stars at the keyboard. So how do we fundamentally change those experiences and innovate as part of the future? So why did we choose AWS? There's a lot of reasons that we chose them. These were the big four that were most important to us, and I'll kind of go through them in order. The first is just the broadest range of services available to us. This is just a sampling of what we're using. It's probably double this, other than they limit me on my number of slides that I want to put up here. But it allowed us to innovate a lot faster, but maybe more importantly, let us do the things we were good at and be less in the technology pieces. So these complex technologies, we didn't have to hire people, we didn't have to hire talent, we were consuming them as managed services, and let us work on the problem space that we really wanted to do. The second one that was really important to us is the size and scale of healthcare data is enormous. We would consider ourselves very early in that journey. We have data on about 250 million people that we're custodians for our clients. We're running 23 petabytes of data a day. We're processing numerous times a day, growing at multiple petabytes a month. We're currently at about 3,300 processing nodes that we spawn up and down, and we're managing data from more than 1,200 different connections, ranging from EMRs to financial to social, environmental factors, and bringing all that together. So AWS to us was important that not only did they have the services, there were others bigger than us. We'd spent a lot of years in healthcare, and particularly EMRs, being the ones that sort of found the boundaries of technology. We really loved the fact companies like Netflix and Capital One were doing things at a much larger scale than we were. So we weren't the first to find the technology limitations, which has actually greatly speeded our innovation as well. The third was it gave us a consistent and cost-effective way to reach around the globe. As I talked about, while most people think of us as a US company, we're in 30 countries around the world. How do you replicate that experience? How do you want to deliver that same experience around the world? How are you going to do it cost-effective? And AWS gives us a single interface that's consistent around the world and is adapted locally. So to us, it looks like one big virtual system, but we're actually able to spawn and meet the unique needs of individual countries. And the one I'm most passionate about as part of this is we can't transform healthcare alone. If this is really going to come together, if we're really going to improve Jane's life, it's actually going to require multiple industries to come together. How do the payers, how do employers, how does life sciences, how do device companies, how does Uber and Lyft and all the consumer devices actually work together? And what's super interesting is AWS had the largest developer ecosystem of all the cloud providers. And it became an ideal meeting place for us to collaborate together. While we may have independent customers and business models, it became an ideal place to blend technologies and to blend innovation together to transform and take on some of these problems. So what's next for us and why I'm up here? These are big areas for us. I suspect if you look, regardless of your industry, if you look at what's on your roadmap, I'll bet it's very similar. These are things we're super interested in and super invested in. So how do we think about the consumer engagement? How do you engage individuals in their daily life? How do we put them in control of healthcare? One of my favorite quotes from a few years ago was, "The consumer is the most underutilized resource in healthcare." And what's ironic is every other industry on the planet, in my opinion, would have started with consumer engagement, and healthcare started with the providers. And you could grade us, it's still in its infancy, I think, on any scorecard. The second is, and you'll see the proliferation if you walk the halls, the number of sensors, both in your phone and in wearables, IoT, Alexa in your home. What role can they play? How do we bring that together? How do we blend that and organize it? How we do it in such a way that maintains the privacy and security of that data, both for the individuals and the organizations. This becomes critically important around things like clinical trials and device manufacturers. Could we all work together to create new age clinical trials? The answer is yes. The question is, how do we want to do that? And we think AWS provides an ideal place to do it. We're very focused on the social determinants, so while our background and legacy is in healthcare, and we understand that pretty well, what role do the social determinants play? How do we engage those? Everybody talks about shortage of healthcare providers, but if you looked at things like mental health, and it's far worse there. So how do we think about housing? Why are we surprised someone's readmitted when they don't have access to water, they don't have heat in their house, and they probably haven't had a good meal in a week? I'm going to guess they're going to be readmitted no matter what treatment protocol we're on, and how we bring that together. We think 17 years for healthcare innovation diffusion is ridiculous. How do we actually work together? Can you imagine digital clinical trials? How do we think about post-market surveillance? Could the FDA, the device manufacturer, and a health system, and a set of patients and providers be working together to run real-time trials? Why not? That's not a technology barrier. It's really up to us to want to collaborate and do that. And then our commitment then is, and we expect our commitment from you, is how do we do that in such a way in open and intelligent ecosystems? How do we create APIs for that? How do we do that in a way that's composable? Can data from one side to the other? A lot of talk in Wilson and around here around interoperability. That's part of the equation. But it's really just passing the data around. It's kind of the history of what happened. How do we actually engage and pass around the future plan? So are we all working from the same script? Can we all coordinate care around the needs and goals of that individual? So I'll land there. My point, I think what I want you to take away from this is healthcare is ripe for disruption. We can't do it alone. It's actually going to take all of us working together to deliver the kind of innovation you see in other industries. My challenge to you is if you engage with consumers, you have a role to play. And can we then organize ourselves in such a way that we can come together to fundamentally transform healthcare for Jane, or each of us, and give us the tools we need? Because as Brent talked about this morning, it's too important to stay the same. So thank you.
Great, thank you, Ryan. It's wonderful to see all the amazing efforts that Cerner has been putting together in order to really imagine what the future of healthcare looks like. And one great way of how AWS is partnering to help enable that technical transformation as it's persisting across the entire system. And one thing interesting to note, and some of the things that came up in that conversation is really around, how do you make data more usable? Whether it's around analytic tools that are brought on across the board to have a better understanding, where am I relative to any sort of quality measures that I'm looking and observing? Or how am I developing machine learning models that help really define how I can help understand the predictive levers of what's happening in my population or across the individuals that I'm better serving. And so when you're looking at deriving new clinical and operational insights, we're seeing more and more customers take advantage of, what happens when I'm able to look at that data, be able to use those tools and really define what's happening next within my population base. And most importantly, and as Ryan mentioned, how do you deploy those models to augment the physician workflow in order to make it more effective across the system? And so machine learning and artificial intelligence is becoming the baseline for a lot of how organizations are exploring making data more usable, as well as incorporating into their practice in order to streamline what's happening within outcomes. I wanted to share with you an example of what GE Healthcare is doing. in really rethinking the patient imaging diagnostic space. By using AWS machine learning services, for example, GE healthcare developers are developing new AI-powered applications to prioritize critical cases. So understanding, what sort of ordering should be prioritized in a workflow perspective in new applications such as their FDA-cleared critical care suite, designed to speed the identification of pneumothorax, for example. And we're seeing how these models can be deployed not only in new imaging devices, but also what happens when you're able to deploy these at the edge. And so we're seeing more and more organizations, whether they're on the provider side, looking at new ways in which they can predict onset of various diseases, or looking from a number of health plans and health payers, understanding new risk models that they can account for, or looking at ways in which they can better engage across their membership base and really understand how to connect the dots within the system there. We also have a number of academic medical centers, such as Duke University, for example, that's using machine learning to really understand how they can produce faster, less expensive, and more reliable models to look at and screen for children with autism spectrum disorder. So I wanted to share with you an example of some of the extraordinary work that's happening in academic medicine to really baseline us for what's the art of the possible for when we're able to move these types of models and developments from research into the clinical practice as well.
Grayson was our first child.
We thought maybe something was a little bit off pretty early.
We were told the wait lists for diagnosis with autism are really long, and I think they've only gotten worse from friends that I've talked to now.
The computer can see things that the human eye simply can't see. Well, when I first started doing autism research, the average waiting time for a parent who's worried that their baby or child might have autism is about a year. And so the challenge was, how do we come up with an app to be able to detect those early symptoms of autism, such as not making eye contact, not having normal facial expressions in a child's home. If a child is diagnosed at 18 to 24 months and provided 2 years of intervention, the average IQ gain is 17 points. So this has a huge impact on people's lives. When I met Guillermo Shapiro, and he showed me that we could do what I've been doing in the clinic using a computer, that was an amazing moment for me.
So I've been doing computer vision and machine learning basically all my life. Using computer vision and machine learning, we wanted to see if we could help create an automatic analysis of autism and autism spectrum disorder.
Guillermo can use computer vision analysis to assess things like facial expression and attention. And so we built a set of movies that elicit these behaviors. And then we can show these on either a smartphone or a smart tablet and use the camera in the device to measure the child's response.
Data gets sent out from the phone to the cloud, and then we would be able to analyze that data, run it through our algorithms to produce our estimates of where the person is looking at. Now that we have this tool, what we hope to do is combine the eye tracking data, the gaze data, along with the motion, and jointly see if they can help in the assessment of the risk of autism.
Families simply don't have access to the professionals that they need. The idea that we could use technology to increase access, that's just a wonderful thought to me.
Every minute, every hour that you're able to implement those strategies, that's helping your child learn that social development and learn it with you. And as a parent, that is really rewarding.
Yeah. I think that if we can do just a small thing to change one kid, I think I would go to sleep with a smile.
So here we got a chance to see some of the work that's happening in the application of machine learning in medical devices with GE. We see machine learning being practiced within a number of academic medical centers like Duke University, but also extends into how machine learning can be applied to operational workflows as well to really support operational excellence across health systems. So Beth Deaconess Medical Center, for example, uses AWS machine learning to drive a series of experiments to help incorporate how they can apply machine learning across their entire organization. And starting with how they can accept the challenge and tackle the challenge of optimizing schedules, for example, across its 41 operating rooms, and align those schedules to improve patient flow across their entire inpatient setting. And so when you're able to look at not only the scheduling aspect of it, but within the actual processes of how they can look at operational flow within that mechanism, you're able to not only apply machine learning across the board, but within each of those practices. And so they're also applying machine learning, for example, to look at pre-surgical documents that can be scanned and incorporated into the EHR. So things like consent forms, for example. So if the system and the model doesn't see a consent form in the system today, how can that be flagged such that a staff member can be alerted and address that concern rather than having to reschedule or push back a specific procedure for that patient. And so that becomes a very powerful way of, in its application from an operational perspective, how machine learning can really understand and improve the entire system as a whole. And lastly, they're looking at new ways in which they're able to look at proactively reaching out to patients that are likely to miss any sort of scheduled appointments that they might have, for example, and improve the entire patient experience and journey from that capacity. So when you think holistically about the application of machine learning in healthcare, it can be from a clinical perspective, it can be from an operational perspective, but across the board, there are certainly a number of opportunities in which our customers and partners are really starting to build a better understanding of its application in that space. Lastly, and I know that Ryan made mention of this earlier, when you look at what's after understanding what can potentially happen from a risk perspective related to individuals as they're starting their healthcare journey or populations as they're looking across the board, understanding how to then personalize that journey for those individuals is crucial because you're able to not only provide a means by which every incoming engagement or outbound engagement that occurs, whether it's a call center call, whether it's a nurse hotline assessment that they're driving, or whether it's an email that they're receiving for a wellness update related to their health. What are all the different touch points that you're able to understand and better provide information to those individuals to better improve and impact their health outcome? And so for a number of cases, whether it's leveraging tools and services like Amazon Connect, or looking at ways in which organizations are using Alexa for Health, for example, to open up new channels and engagement patterns across the board. We're seeing more and more organizations be able to take advantage of these different types of engagement paths in order to improve and engage individuals across the entire spectrum of care. Secondly, as you look at and think through beyond what has historically been the case for medicine and care, what does it mean to have applications? What does it mean to have different treatment plans? Or when you think about different ways in which you're able to address them from a digital perspective, more and more customers are thinking, what is beyond the pill now? What are ways in which they're able to look at digital therapeutics to support a broader agenda and broader campaign across their patient and population that they're able to address using technology and tools? And so when we take a step back then and look across, what does it mean for these opportunities across healthcare? As I mentioned before, whether it's around IT and clinical transformation and using that data to help drive more information and analysis and insights, you're able to understand how to support clinical and operational excellence. And from there, be able to then create a digital front door for your patients or members to effectively engage with them across the board and truly think through what does a modern day healthcare experience look like for them? What does that engagement path look like for them? And really then holistically address them from a digital therapeutics place in order to support what does it mean to have personalized care and precision medicine across the board. And when we take a step back and look at the broader convergence points across the industry, it's not only healthcare, it's becoming a broader conversation that we're having across the entire space, whether it's genomics and looking at how the storage of genomic data, for example, can then be applied and inform early phase research for life sciences companies to then go through that entire process to apply it to the clinical setting and clinical care. You see how this conversation and dialogue is beyond not just what we're engaged with on a day-to-day basis of healthcare in and of itself, but a broader conversation that we have as an industry. And it requires everyone in this room to think big and think bigger beyond that. And it's incredible to see some of the work that's been taking place from that capacity. Because when you're able to be truly customer obsessed, combining that with a long-term orientation about how this all comes together, and then being able to invent on their behalf, whether it's new services, new tools, or new solutions that are taking place across what everyone in this room is focused on, we can see how transformational it can be for healthcare. And so moving data to the cloud, looking at healthcare interoperability and data in the cloud, being able to derive clinical operational insights and support what does it mean to have those processes more effective and efficient within the system, and then truly understanding how to personalize care for those individuals brings together a broader conversation that is taking place and what you'll hear about throughout this week. And so all of that is to go and say, when we look at it from a digitally enhanced, data-driven healthcare perspective, we're able to look at population health initiatives, we're able to look at precision medicine, and be able to look at it from a technical perspective and enable organizations across the board, whether it's academic medicine, whether it's healthcare IT companies, to really understand how cloud is becoming more and more the case that it's the norm in healthcare. It's no longer really the exception. And more experimentation and innovation is happening in the cloud as a result of that. Secondly, as we're looking at designing services with healthcare in mind, whether it's related to high trust, whether it's related to HIPAA, whether it's related to health data hosting in France. There are a number of programs that we'll continue to invest in to help support a lot of the initiatives that you're driving in the space. And on top of that, continuing to work with you and being able to help drive what our roadmaps look like from Amazon Comprehend Medical and Amazon Transcribe Medical, for example, and really start understanding how we can work together to co-innovate and be able to bring together services that help remove that undifferentiated heavy lifting so you can focus on the solution. And then lastly, as we look at personalization, it's becoming more and more foundational and as well as more and more instrumental for how precision medicine is going to be taking place. And so the investments that customers are being able to put into understanding what those journey patterns are going to look like, as well as taking advantage of the tools and channels they're able to support across the space, whether it's using new AI services, whether it's using Alexa Health. There's across the board, personalization is that really first step towards precision medicine, and we'll continue to support organizations from that capacity. So lots happening in 2019. There's a lot more to come in 2020. And as you go about your week, the conversations that start today and start with this session really span across and dive a lot deeper into what we've started the conversation with. So whether it's around healthcare data interoperability on AWS, all the way through to understanding what does it mean to have clinical applications on AWS, and across the board from a regulatory compliance perspective all the way through to understanding VMware Cloud on AWS. So this is a broader conversation that's taking place. We'll dive deeper into these throughout these sessions throughout the entire week and really start understanding ways in which we can expand the opportunities to have this conversation and dialogue across the board. And it isn't just these sessions that this dialogue will take place. Wanted to make sure that we take advantage of the opportunities across the board throughout this week. So our Healthcare Life Sciences Networking Lounge, for example. So just right outside, right around the corner, you'll have access to a number of our healthcare life sciences experts as you are architecting new solutions or want to have a better understanding of what's happening in the market. We're here to better serve you, and we want to be able to continue to engage you not only this week, but throughout the year. But please do stop by, take advantage of this opportunity to engage with us because we want to continue engaging with you. Customer session really starts paving the path of all the different types of initiatives that we're working on this year, and we want to make sure that that dialogue is open. Lastly, as we look across the events for tonight, wanted to make sure that you are all invited to the cocktail reception that we're hosting tonight and this evening at the Mirage Hotel. So between 6 and 8 p.m., a number of healthcare, life sciences, and genomics customers, partners, as well as AWS staff members will be available for us to all just mingle. This is a chance for us to all get together, have a great conversation, start a great dialogue, and understand opportunities in which we can engage together. So with that, I will send you all off and enjoy the week, but I wanted to make sure that we all baseline ourselves with understanding, I think Ryan put it best, it's never going to be a single organization that changes healthcare. And it really starts opening, how do we create the dialogue and start the conversation for how we can work together to change and transform the healthcare space. So I appreciate you all joining today and looking forward to engaging with you throughout the week. Thank you so much.